Taking a break from the heavy duty and going out for a trip, it's really enjoyable. But for some of them, it is not like that. For them, when they travel, they start vomiting. They have a very unpleasant journey, especially so if the road happens to be like this on the mountainous terrain and the roads are very curvy. See, for a normal person, the sensory input, that is, all the signals from the eye, signals from both the ears, from the neck and the body, it goes to the brain, and the brain interprets the position of the body. But in those persons who have or they are suffering from travel sickness, what happens is these signals, when it reaches the brain, the final interpretation of the brain, there will be misconcept in that, misinterpretation. Why it happens so? Chemical changes we know, but why it happens on that particular person, the reason is not known. So this results in vomiting. So motion sickness or travel sickness means because of the mismatch from the sensory input to the brain, it results in nausea and vomiting. That's what happens. And this is very common so in females and in children. And in children, as and when they grow, they attain puberty, the severity of the travel sickness, it comes down. Now, let us see what happens during a travel. So, as and when the journey starts, first they say they have abdominal discomfort. Then they start sweating, slight heavy-headedness, slight headache, and they want to get fresh air, and they have this nausea feeling, and suddenly they start throwing out. Once they start vomiting, it keeps on continuing, and you have to stop the journey so many times, and the journey becomes one nightmare. It's not a smooth one. So, coming to the treatment, and before that, let me tell you the risk factors. Who are the persons who are more prone for motion sickness or travel sickness? Children are more common, I've already mentioned, and more so in females. And those people who don't prepare themselves well before the travel, they know they have motion sickness. In spite of that, they take a heavy dinner previous night, or in adults, they take the alcohol intake is more, or the day before the journey, their workload is more. They try to finish up all the work, they become very tired, and the next day want to travel, or they have some sort of minor illness. All these can aggravate travel sickness the next day. And if suppose a lady who is affected with travel sickness, they are traveling and they have periods during the time, they are more prone for motion sickness. Pregnant ladies, already they have a tendency to vomit. And when they travel, the tendency increases. They tend to vomit more. They precipitate faster. Now, the one last point, let me tell you, then I'll go on to the treatment part. Those patients who are suffering from migraine, there is a very, very high possibility they have coexisting, they have more travel sickness, motion sickness also. Now coming to the treatment. See, prevention is better than cure. So let me tell you how to prepare ourselves before I travel. After that, let me name some medications. See, suppose you're traveling tomorrow, and today, the day before travel, night, take light dinner, and you can take more water, intake is good, and try to sleep early. Usually what happens, most of them, they're busy with the work, they forgot so many things, they want to pack all the baggages, and they sleep very late that night. Try to avoid that. Try to sleep early. If the adult, those elderly members who want to travel, they have the habit of drinking, taking hard drinks, try to avoid during the time of travel, the day before travel. Now, the preparation of the car. Suppose you happen to travel in the car. So what happens is, those patients who are prone for motion sickness, their sensory input is very important factor. So when they see fast moving objects, as the car travels fast, when they see fast moving objects, it precipitates. So my advice is, when you travel in the car, try to have this sun shield with a thick one, so that it acts as a sun shield and it hampers your vision also. See, this one, the person is removing the sun shield and is replacing, just to show you that is the one to be used. And I have put in sun shield in all the four doors except for the driver's seat. Even there it can be used, provided the vision that side is clear enough for the driver to have a look. This can hamper your normal vision so that the sensory input to the eye is less. Now, the date of travel. So you start your travel early morning, say about 3:30, 4 o'clock. And the children who are more prone for motion sickness or travel sickness, you make them sleep in the car. Don't wake them up. Let them sleep. And try to cover as much of distance as much as possible before they get up. So you have few advantages for that. One is they are sleeping well, no disturbance. Two, you cover as much of distance as much as possible. You don't have to stop the car anyway. Three, and their body slowly gets accustomed to the motion. So this is going to help you. Now, small advice to the driver. Tell him, suppose you drive, keep these points in mind, that sudden braking, sudden acceleration, sudden turning of your steering wheel to the left or right, please avoid this. Now, coming to the position of the person, how they are going to be, and few more things to be done in the car. When you have covered maximum distance, and it is about 7 o'clock or 7:30, time for the children to get up. So when they get up, the usual practice is going to be, you take a phone or tab and hand over to them, you tell them to keep themselves busy till you stop the car for the breakfast. Please don't do that. Because watching something in the phone or tab, or watching even outside continuous fast moving objects, or trying to read something is going to precipitate. So instead of that, what you do, you keep them engaged in some sort of talk, or tell them some fairy tales, or send and pick up a story or some past good experience and keep them engaged. So this cannot go on for long. In that case, what you do, once the topic is over, maybe you reached your hotel for your breakfast, you need to stop for the breakfast. So in that case, after that, you can continue with some other topic or listen to light music. You keep them engaged. But what are things to be avoided? Please do not give them any food, and they should avoid reading any sort of books. And the person, suppose the adult is there and she is the one who is more affected, in that case she will be sitting in the front seat. If suppose she knows driving, let she drive. If not, she will be in the front seat, co-passenger, and she should be looking through the front shield, not to the side. Now, listening to music is good, like how I mentioned. Now, the sitting position in the car, which I have already mentioned. For the adult, front seat, either driving or passenger seat, looking forwards. Children with the seat belts, all of course, behind and with the seat belts and looking forwards or listening to your parents talk. If suppose you're traveling by flight, in that case, you request for a seat which is just near to over the wings. So that is going to be better than you sit in the front or rear. Suppose you happen to go in a boat, try to avoid the front, rear or the side. Try to occupy the center seat. And suppose you're traveling by train, you have 2-tier and 3-tier. Try to occupy the lowest level possible, not the upper ones. This is about the position. Now, in spite of doing all this, there are few patients who are very much prone for motion sickness, and whatever way you do, they will vomit, they'll throw out. So in that case, let me tell you few medications so that you can prevent it. You take it before your travel. See, all these videos which I've been uploading all these years, it's about more than 1,100 videos. I have never mentioned any medication or any name of an antibiotic or any name of any particular drug. This is patient teaching program. But in this topic, I'm just mentioning because all these medications are easily available over the pharmacy, over the counter. So even if I don't tell you, I'm sure you're going to go and buy it. Without even knowing the name, you go to the counter, you tell them you're going to travel, they're going to give you. So better that let me mention. The first one medication is that is scopolamine patches. It contains hyoscine. So scopolamine patches, it comes in 1 milligram patch which has to be attached behind the ear 4 hours before the journey, and the action is going to last for at least for 3 days. So the side effect being a dryness of the mouth and possibility of hallucinations. If suppose the patch is not available, your alternative is going to be same medication which is available as a tablet or syrup. So in a tablet, it comes as a strength of 10 milligrams and it's available as syrup also. So in general, if you see the dosage for children especially, between the age of 2 and 6 is going to be 3 ml 2 times daily, and above the age of 6 to 12, it is going to be 5 ml 2 times daily. For adult, it is going to be 1 tablet 2 times daily. Suppose it's a plain tablet. It's better that you take plain tablet. Now, what are the drugs? One is scopolamine, that corresponding tablet, which is hyoscine, which comes under the name of Buscopan. Next being Phenergan, it comes as 25 milligrams. And you get this cough syrup, this Benadryl, that is also very good. Then Phenergan, which I've already mentioned. Then you have so many other drugs like which comes under the same category of antihistamine, meclizine, that is also good. Dicycline. Then Phenergan, that also comes as 25 milligrams. Phenergan, that is already mentioned. Topromide, then that comes as metoclopramide, etopride. Then you have Stemetil. It comes in 5 milligrams, 10 milligram tablet, and it's available as syrup also. The last one is ondansetron. It comes under as Emisset. Emisset means vomiting. So the strength of the tablet is 8 milligrams. For adult, it will be 1 tablet 2 times daily. It comes as syrup also. It comes as MD tablets also. More dissolving tablets also. So these are about the drugs. So almost all the drugs, they have mild or moderate sedation. And strength I have mentioned, and how much quantity to be used also I have mentioned. So the tablets has to be taken at least 2 hours or 3 hours before the journey. And twice daily. That is the strength. Now, scopolamine patches, or let it be tablet. In the case of children, side effect, or an adult also, side effect I have mentioned. But in adults, it is contraindicated in few conditions, like if they have the gastrointestinal obstruction, they have increased tension inside the eye, which is called glaucoma. These conditions, it is contraindicated, or they have urinary retention, they are taking tablets for that. So, scopolamine cannot be prescribed for them. You have to look for an alternative. So, be careful when you avoid giving scopolamine to them. Now, about the medications I have mentioned, let me tell you some natural remedies to cure. See, often you must have seen people taking, trying to smell lemon, So let me tell you at least more alternatives so that whichever is available, you can make use of it. The first in this, you have this ginger roots or ginger tablets. It is very effective, just like lemon. Other alternative being, same thing, the same effect you can have clove or cinnamon also. Among the essential oils, if you see, peppermint oil is good, and peppermint oil, lavender, and chamomile oil. All these can be applied in a handkerchief, or they can apply over the dress also. If suppose you want to apply over the skin and ask the child to smell, you have to dilute it. Normal application, smelling directly is no issues. If you want to apply over the hand or over the skin, you have to dilute. You have to apply 2 drops and apply 4 or 5 drops of, mix it with 4 or 5 drops of coconut oil. That will be the concentration, dilution. Now, I have mentioned the risk factors for it and how to prepare for the journey, and the position, and during the journey what all things to be done, what all things not to be done, And medicine you can keep in hand. Those patients who are very prone, they can take medicine. That doesn't mean that can let go the other normal things which I have told you not to do. They have to take medicine as well as they have to take all the precautions, because even if it's one person who is affected in the journey, the whole journey gets affected. How even the others get affected. So it's not going to be an enjoyable one. So these precautions, these are really going to help you. Thank you so much.